My name is Pamela Downey. I am a licensed mental health counselor in the state of Florida and a therapist in private practice as well as here at Gulf Breeze Recovery. Believe it or not, the first piece of the picture in beginning to heal trauma is understanding trauma, is validating somebody's experience. Validating, do you see how this is connected to this is connected to this, how this impacted that? And then the only way to feel better was via a substance or via, other addictive or maladaptive behaviors. It's innocent to want to feel better. In fact, it's adaptive to want to feel better. But if ultimately the outcome leads to more of the same, I don't feel better. I feel worse. And actually, what I thought was helping me cope with something is making me feel more shame. And that's another thing that we really have to be sensitive to in the treatment of trauma. When you are removing an adaptive mechanism or what's thought to be an adaptive mechanism for somebody, you don't just rip that away and say, here you go, I hope things work out. You say, I see why you feel this way. I want to understand more about your experience. And then from there, there's a lot of different treatment interventions. The one that I practice most primarily is called EMDR, which stands for Eye Movement Desensitization and Reprocessing. And it's an integrated trauma treatment approach that has 8 phases that recognizes a person's history, their skills and ability to ground themselves, meaning to be present in this moment, to be able to recognize their affect, their emotions, and to be able to shift those enough to where they recognize what experience they're in before they're behaving, which is a very big impediment in substance misuse, is that we have now numbed our most effective mechanism to tell us how we feel and what to do next, because guess what? We didn't trust it in the first place. We need that back online so that we can do the work of really beginning to trust the system again, trust their system to guide them along the path of treatment. A client really gets a hold of understanding their experience and being able to begin to regulate their experience again. So it's very individualized and tailored to the individual. The middle phases are accessing and activating a previous trauma, bringing that trauma to working memory, being able to recognize that and redigest that is part of what is intended, bringing that to working memory. Beyond the desensitization phase is how we would like to feel instead. And so once the disturbance of any particular event has been dissipated, what we then look towards is, okay, how does this person want to feel instead? Let's say the traumatic incident left them feeling like this was my fault, I should have done something different. And how they'd like to feel instead was, I did the best I could, it's over now, and I can move forward learning what I learned from it. And we measure that, see how true it feels. And we introduce, again, bilateral stimulation to help the brain through what's called adaptive information processing, which means the brain has the natural ability to redigest something or to orient towards health and well-being. It's exactly what we talk about, teach, and practice at Gulf Breeze Recovery. So the intersection of the principles and EMDR therapy, as we utilize frequently here, is an excellent intersection, because what it does is it focuses around, honors and respects the capacity of the individual to produce their own healing with assistance and support. We want to take a very careful, thoughtful, comprehensive look at what they have experienced in their life that has been of traumatic impact to them. And I think we do that beautifully here, and I'm privileged to be a part of it.